to welcome you all on the 22nd webinar of Medgini, where we are today going to talk about the future of pharma marketing, which is Phygital, physical plus uh, digital. And we are also going to touch upon a key area of interest to all of us, which is trade intelligence. And with that, we are going to start the webinar today. And we have got a lineup of great speakers who have joined us today, who have come with a intense experience, who have been there, done that across leading organization, which we'll be introducing them shortly. Before we proceed for this webinar, I will be interested to know a little background about you who have joined us today, taking out time on this Saturday, and especially being the last day of the month. I would like to understand from you in terms of your location, place, as well as the background. So we have about 150 plus people who have registered for this webinar, and they will be joining us shortly. So before we proceed for the webinar, let me give you a benefit of being a part of this particular webinar. And the key areas that we are going to cover today in this webinar is real challenges in terms of executing digital in the physical world. So we will be talking about examples that are of relevance to all of us while we are executing these strategies. We all believe on the power of digital, and we also understand the challenges when it comes to executing the same at the ground level. Second important thing that we want to touch upon today is trade intelligence for taking smarter decisions. We all understand that we are having a lot of data, and in this digital world, how do you actually use this data to take decisions? We will be touching upon that with a real life examples. The third key area which we wanted to talk about today, which is of interest to all of us, which is doctor and chemist engagement strategies using physical as well as digital. With a limitation of time, we'll be asking the speakers to share examples of how they have done that in their previous organizations as well as in the current organization. The fourth area is to measure ROI. ROI is a very important thing. As marketeers, as businessmen, we are very clear that any strategy, if implemented, should give a ROI. And how exactly this can be measured is something which we will be touching upon today. The fifth area which we are going to cover today is AI and analytics. In the current world of AI, what is the skill set that we need to have as pharma marketeers, and what are the tools that we need to utilize on a regular basis so that we are able to do our job better and smarter. For all the people who are joining us today till the end of the session, we will be having an ebook of the future of pharma marketing, digital and trade intelligence. And this session will be having real life examples, which I have told you, which will be converted into an ebook and shared across to you by next week. And this will be on the conversation that we will be having today in this webinar with the speakers. And we also have a chance to participate into a self-assessment test on knowing where do we stand currently when it comes to Phygital. So two winners, there is no right and wrong answers for this. There is a cell scorecard which will be sent to you to your inbox immediately once you participate in the session. And I request all of you to please participate so that you are in alignment to what exactly we are presenting. The winners for the people who are participating, the two winners will be able to get a hard copy of the book, Sentiment Analysis for Pharma Marketeers by Subbarao. Subbarao, sir, is a author, and we have followed so many book of his. And currently, he resides in US, and he has worked in the India pharma industry for quite a long time for larger organizations like Sun Pharma, GSK. So this book definitely is a must read for people who are able to win this, and people who are not able to win this also. You can find this book in Amazon, but this is definitely a must read. So introduction about myself. I have joined in from Hyderabad. I am the founder and CEO of Medgini. I started this in 2012 with the whole objective of helping pharma industry to connect with chemists and doctors. Before this, I was working in IT and telecom as a employee and then converted to become an employer. And I have been humbled to be a part of Business World 40 Under 40 Power List. They have recognized the services and the contribution we are doing in the healthcare industry. From a hobby standpoint, I enjoy doing cycling, dancing, as well as reading. I live with my parents, my wife, and my children's here in Hyderabad. So it's a beautiful world, and I'm delighted to be a part of the session today, hosting today for all of you today. And we are going to definitely deep dive with our speakers who have joined from two different parts. So we have the first speaker, Sanjay Shukla sir, who has joined us today from Patna. He is from Mumbai, but he's been kind enough to accommodate his schedule for us. And really grateful for Sanjay sir to be a part of today's session. Sanjay sir comes with 30 years of experience across pharma sales marketing and trade channel management. Sanjay sir has led large, high-impact team across multiple geographies and therapy areas in leading organizations such as GSK and USP. In his current role as General Manager, Sales and Marketing in USP, he focuses on building strong trade strategies, improve channel efficiency, and ensuring consistent execution on the ground. He has built scalable trade channel and CRM-driven engagement models. His experience spans across key therapy areas, including diabetes, derma, pain management, as well as general medicines, with a strong focus on both urban and rural markets. So, Sanjay Sir has completed his senior management program from IIM Calcutta and management development program from SP Jain Institute. So, it's a great honor to welcome you, Sanjay Sir, to today's session.
Thank you, Ashish ji. Really appreciate your kind words. Welcome everybody on the call.
And the second speaker for today's session is Abhishek Sawant. Abhishek Sawant comes with 11 years of experience across pharma, digital initiative, and omni-channel marketing. Abhishek brings together strong pharma knowledge with practical execution. His current role as CX manager at GSK Pharma, with a prior experience across Wockhardt, Doplex, Pharmarack, Trinity Healthcare, and Glenmark. He offers a 360-degree perspective on how pharma brands move from strategy to real-world impact. He's a gold medalist in M-Pharma and MBA in marketing. So his journey reflects a strong foundation in both science and business. He has been closely involved in building award-winning omni-channel programs. His area of expertise include digital and omni-channel marketing, HCP and trade engagement, lead generation, and customer experience. So I welcome Abhishek to be a part of today's session as our key speaker.
Thank you so much. Looking forward to contribute and learn from everyone.
Thank you so much.
Thanks a lot.
Yeah. So with that, I would also like to welcome all our delegates who have part of the program today, taking out today's time and learning from each other. Their experiences is very important for all of us. As I told you, the areas that we want to cover today is Phygital. We have divided the entire session in three parts, which is segmentation, targeting, and positioning. As we know, segmentation, targeting, positioning are the basis of marketing for any organization. And we are looking about segmentation in a very different way to help us execute strategies in both physical and digital world. So with that intent, we would like to ask a simple question to all of you. A simple question to all the delegates here who are part of the session. If digital is stopped tomorrow, just imagine if digital is stopped tomorrow, would your on-ground execution still perform with the same expertise, or will it take a backseat? So I would like to hear from you in the chat. If digital is stopped tomorrow, would your on-ground execution will work in the similar way, or will it take a step back? So please answer in the chat. So we would like to understand from you. What do you feel if digital is stopped tomorrow? We understand digital is definitely adding a lot to our business and the way we are working today, including our personal life. So if digital is stopped tomorrow, what exactly is the impact to our business? So Bharat Mohan says it will take a step back. Yes. So I would request all of you to be please active in the chat. And Ankur says that it will take a lot of traditional efforts then. Yes. So the dependency on digital has definitely gone up in terms of how we execute things in a smarter, faster, and better way today. Um, so we have a small self-assessment activity which was recommended by our speakers, Sanjay sir as well as Abhishek. They wanted to understand and give you a self-assessment score, which is personal to all of us. Depends on the journey that we are in the organization and in our career. This is a QR code. I request all of you to please scan this QR code, or my team will put it in the chat. This I've got 10 questions which we'll be asking to understand where do you stand currently with regard to physical and digital strategy adoption in your current role. So please scan this QR code and participate. We've got 3 minutes. That's very simple. You just need to put in your name, email ID, mobile number, and answer to this particular questions. And once you are done, please type in done in the chat. And the fastest person will be able to get this hard copy of the book, which will be delivered to you by next week by our team, which is Sentiment Analysis for Pharma Marketing. It's a must read book for any pharma marketeers who are serious to level up their particular game. So I would strongly recommend this book. This is not a very, very costly book, but the value that it has in this book definitely adds a lot to your business. So we as Medgini, we don't have any intent of selling this book to you, but it's a personal recommendation from our side to read this particular book. And the two lucky winners will anyways get this book from our side and will be delivered to you hard copy at your doorstep. So please scan the QR code and participate in the self-assessment test. And we have seen two people have already done that. Ajit, thank you so much. Bharat, thank you so much. So others also please be active so that you are able to take value from this session. We don't want this session to be a theory session. We want you to learn something and implement from tomorrow in your business and level up your particular game. So with that intent, I request you to please be active in the chat. If your videos are on, we'll be able to resonate with you in a better way. Right. So we have Manish also completing is great. So my backend team will anyways tell us who are the winners at the end of the session, and we will be able to give the book to them and announce the winners at the end of the session. So the first question which arose when we were crafting this webinar was basically on segmentation. So segmentation, as we know, is a strategy where we are able to identify a group of stakeholders based on their roles and behaviors. So while we segment this particular audience, be it doctors or channel partners, and ensure that our strategy is alignment to the objective that we want to fulfill, many a times we face a lot of challenges. So my first question to Sanjay sir is on the main challenges. So as pharma marketeers, he has 30 years of experience working across uh, two different large organizations. Sanjay sir, we want to understand from you what are the major challenges in using digital and on-ground strategies together. So
Sure.
request you to please give us light on this particular topic.
Yeah, thanks for the opportunity, Ashish. First, hope I'm audible. If you can confirm.
Yeah, loud and clear.
Yeah, thank you very much. So, before I say anything, first the disclaimer that whatever I'm saying as an individual. In my personal capacity, it has nothing to do with my organization I'm working for. Uh, I think the question is very interesting that, which are the challenges when we are thinking as marketeer or even as a sales leader for implementing sales strategies while using both the channels of digital as well as physical. The biggest challenge I find today is in many companies, while some organizations have already integrated their databases and they have single view of all KPIs in one place, in one dashboard or one data platform. Many companies still have CRM data sitting separately, call reporting activities sitting separately, sales dashboard having a different platform, secondary tracking at a different place, and therefore it prevents you from seeing a single view. So that's one very big challenge for a marketeer. Some companies have resolved it, some are still work in progress. Second thing is, when you are budgeting, because in marketing, it's all about strategizing and then kind of allocating funds. Since the ROI from digital channel KPIs now are clearer than where they were 5 years back, but still it is very difficult to kind of exactly assess, especially when you have multi-channel strategy, when you are present everywhere and you have omni-channel strategy, then how much is coming out of your digital deployment or strategy deployment, whether you have in-house capability or you're using a third-party vendor. Another difficulty I see is the collaboration with the face-to-face. So all companies have face-to-face feet on ground, and all companies are using digital access channels like webcast, like WhatsApp broadcast, SMS, email marketing, and all possible channels. Now, how do you integrate? Because we are ahead of that curve now, which we were talking 10 years back that we need to have a hybrid rep. Most companies have hybrid rep strategy now. Companies have medical rep, companies have digital strategy. It is moving from hybrid reps now to a rep, which is to a strategy where it is unequal to one kind of segmentation, as Ashish was talking. So individual doctor journey is being tracked digitally or otherwise, and then your messaging has to be customized. How do you integrate your rep collaboration, which will still feel digital as a threat in some cases, and how do you integrate them and kind of have integrated strategy? Another thing I see as a challenge is if you talk about the face-to-face promotion communication, we always had time. So as marketeer, we had a campaign time or a, you call it cycle or whatever in individual company. You have 3 to 4 month campaign. So you create a data, accept few reactive strategies as per the market need. By and large, your communication used to stay same for at least 1 to 3 months. Versus in your digital strategy, if your content is not getting refreshed on weekly basis, your traction will go down. Now, in a very regulated industry like healthcare, getting a content at that pace sometimes in some companies become difficult, and especially companies which are very compliant, and most companies are compliant now post UCPMP. So the getting approval from legal, from compliance, from medical, and constantly refreshing your data and having right kind of KPI is another challenge. Another difficulty now, which has come to the fore because of digital tracking available and the AI-enabled tools at your end, and the data analytics are becoming sharper and individualistic. Now you can very clearly see which geography is contributing, which geography is not contributing. Now you can see which pin code is contributing and which pin code is not contributing business. And therefore, the strategy which used to be earlier one vanilla for all is no more relevant. You need to have very specific data-based, customized strategy based on the traction of the brand happening across, whether in terms of RX or the sales. And then the associated KPIs which can actually measure that. And as very rightly mentioned by Ashish, UCPMP is in place. So the content creation becomes it has to be very measured, very correct. And then how do you maintain both? Where on one hand, digital invariably will require a very high, fast paced content creation. On the other hand, the regulation will mandate you to be very measured, very correct, and very legal in the way you do that. And then, of course, the economy also evolving. So, 10 years back, when you see most of the companies from a strategy standpoint, they were focusing on demand creation in metro class 1 and max class 2 towns, because the economy was happening here, the demand creation was here, and then remaining geographies were only getting the brand or the traction what has been created in the metro and class 1. Versus what you see now is economy is happening across all tier towns. So it's no more your strategy, if it is focused only on metro and class 1, you are in for a trouble in long term. Because rural economy is happening, the healthcare penetration happening, the infrastructure upside happening. And therefore, even for some of your tail end brands or the legacy brands where you were getting sales for demand created long back and repeat purchase, walk-in patients were buying, even that is under stretch because the healthcare penetration reaching to those tier towns also. Secondly, digital also exposing a lot of difficulties which were earlier not even known. So the stock out situations, the availability status of tier 3 and below. There are channels and there are third parties or vendors available. Medgini is one of them. There are more in country. which can tell pharma companies that, look, we will not only make you reach to geographies, which was not possible earlier because you'll always have resource constraint. They are giving you the data of those geographies, and they also have capability now, feet on ground, to create demand in those geographies, so-called tier 3, 4, and tier 5, which most pharma companies still find difficult to reach out and deploy a rep for various regions. So I think these are the key differences I see as of now, Ashish, in deploying both the digital as well as face-to-face strategy in brand management.
Perfect. So, Sanjay sir, thank you for your insight. The one point among the many points that you have shared with us, which resonates with me, is basically the availability of data and use of data. So, you are mentioning that data is definitely available from various sources, right? So, how easy or difficult it is for a life of a marketeer to choose what is relevant and what is accurate? Is it becoming simpler or difficult for a pharma marketeer?
No, it depends, it depends on your strategy, whether you're going for niche marketing or you're going for, what you call expansion, depending upon your brand life cycle, depending upon resources you have. So I think there are various elements which will decide. Data per se is data. Now, how you use it is wisdom. So, so I'm sure that marketers know that what they want. Only thing is the landscape changing very fast. Just to give you one example, Ashish, that, before this AI boom, a lot of this digital content creation used to happen through agencies, third-party agencies. Now, in most companies, including mine, brand manager themselves can do it because they all use AI. So the flyers and all, and then a lot of content which we were dependent on the third party to create for us, now has been created in-house. Companies have their own capabilities of what called WhatsApp broadcast. So if I am a vendor or if I am a marketer, whether a pharma company or a third party, if I'm not keeping an eye on the evolving situation at a pace it is evolving, I think I'm in for a trouble. So data per se is there in plenty. I need to have understanding of data, and then we can customize and use it, because now you have AI assistant also doing it for you. So even if you don't know how to do it, artificial intelligence, machine learning will do it for you. So I don't see that is a difficulty anymore, Ashish, which used to be in the past.
Perfect. Being curious and knowing what exactly is relevant in the days to come is something which pharma marketeers to be very vigilant about. So the
One
second
thing,
question,
Ashish, before, if you permit me to say this, one thing I can tell with confidence to the audience, what was possible, say, 5 to 10 years back, which many companies used to believe that we will create demand, we will create prescription, and the channel's job is only to fulfillment. Now that has already changed. It's not changing. It has happened now. Channel is building muscles year after year, and the power of channel is significant now. Now, no pharma company can afford to ignore channel, and then no pharma company can treat channel only as a. And when I say channel, I mean pharmacies, stockists, hospital pharmacies, online, standalone hospitals, all that put together. So no pharma company can afford to treat them as only a channel for fulfillment. Now they have to be, and they are in most pharma companies, they are part of brand planning. So channel now is seen as a separate growth lever. So when you are forecasting and estimating and creating future business plan, you actually attribute how much will come from your SCP RX creation, how much can come from channel. Channel can create demand. Channel can prevent your erosion by preventing leak and switch at pharmacy level. So when I say leak and switch, I mean if your brand is not available, it's leak. If your brand is available, still pharmacy gives something else, it's a switch. So, that can be prevented if you have a channel strategy. And then you can reach out to the geographies where if you're not available, despite having a demand, you'll not be able to generate revenue. So channel is here to stay, becoming more and more dominant every single passing year. And you have to have very clear integrated channel plan, part of your brand strategy, not as a separate part of only seeing from a perspective of how much provision I'll make for discounting and therefore how much revenue will come.
Thank you so much, Sanjay sir. I take your particular point. The second point which we have for Abhishek, which is a key area of interest to all our pharma marketeers, and he has a big experience when it comes to digital. So the second question to you, Abhishek, is how can digital strategies improve the experience uh, for doctors and chemists? So we always feel that digital will make a difference, but how is it going to improve the experience? Can you please help us understand this?
Yeah, sure. Thank you so much. Again, a disclaimer: these are my own views, not belonging to any company as such. That way, okay, fine. I guess the screen is visible by somebody. Okay, fine, no problem.
Yeah.
Sure. So I think the way which you mentioned how it changes the HCP experience for the chemist or even the doctors per se. So now when look at whenever we design anything digitally, we need to understand that how are the placements of touch points around the physician, whom physician is meeting, and what he is expecting from either a patient or maybe or an MR or anybody. So generally, if you look at a doctor's day, what all doctor checks around. So he sees the patient, he sees the medical rep, he sees his phone, he is part of couple of medical groups, he is looking off online on the journals as well. So these are all the touch points in which doctor is present. He's somehow trying to find information or rather relevant information from all these channels. Correct? Now, the reason if you look at how to improve or rather how to create a right digital plan is knowing that how these touch points actually add value to him. Correct? So you should be present where doctor is going and you should add a relevant content there. If you look at the basic terminology of digital, just to start with, for demand generation, it all starts with we know four P's of marketing. Here, in digital, I say it is three C's of basics of digital, which is community, content, and commerce. You take example of maybe a TikTok or a YouTube or even Orkut per se or Instagram per se. Instagram is a community. People, all the brands are present on the community sharing the relevant content. Similarly, maybe High Doc, Docplexes, these are the names which are a community of doctors where they are coming together. So they want to know relevant information from the peers or even from the marketers in the right content format. But the reason it fails is because just because we think LBL works with a medical rep, uploading the same LBL on a community platform or a WhatsApp channel will equally help. No, that's why they have even changed the name of the content. For example, all hair on the same whole body are not called the same. They change. Similarly, a 3-hour video is called a movie. 1 hour video is called an episode. 30-minute video is again called an episode. 20-second video is called a reel. So based on your length, so these length are defined based on the channel which you choose. If I go to a movie theater and see a 20-minute reel, I will feel waste of time. Similarly, if somebody sends me an entire conference or a medical conference summary, a video summary of 1 hour medical conference on WhatsApp, it will not be seen. Nobody uses WhatsApp to watch a 3 hour or a 1 hour long video. Correct? So when your screen gets shorter, your content should equally get shorter and more relevant and more thicker. That is the purpose of the content. So for example, if doctor is meeting a patient, he will be happy to know how the pharma company is adding value via digital touchpoints in patient's life into one of the patient engagement programs. They can be for diabetes, chronic therapy, they can be for therapies like cancer. It will add value, doctor will be happy. It will improve his experience of interacting with patient because his one of the problem is that patient is not taking a pill or he is not complying enough. Digital touchpoints in patient life will improve doctor's experience and reputation for the company. If he is using a phone, he will be either having opening WhatsApp or email. Now in India, email open rate could be less in single digit, but the market which I handle in my current company, open rates are up to 80% as well. People show interest. If you have a good value, it is doctors will show the interest. But sometimes when your own content is bad, we blame the channel. That should not be done. If, for example, if you are sending a same reminder of a pantoprazole tablet, doctor is not interested. For example, if you are again sending that we have semaglutide, doctor will know, yes, I know you have semaglutide. So what? Doctor will be interested to know an infographic on the phone. That will improve his experience because in one infographic, in digital format, in visualized format, he's getting the answer which he wants to know. That is tick mark. In email, if it's a value added newsletter, he will show the interest. And that is the reason if you just type diabetes on the Google search bar, you will not find any pharma company's website in first 20 pages. Not possible. The first website which comes around is by Mayo Clinic, second is by WHO, third is of Cleveland Clinic. So why these websites are coming into picture? Because they are acting a relevant content, they are researching the relevant content, and they are putting the relevant content so that reputation is built over a period of time. When I had visited one of the companies, GM long back, and he gave me a card. He was handling a cardio diabetic molecule. That time I was in Doc Plexus. His visit, his website of that brand was written on his visiting card. But when I clicked on that link, it showed 404 error. So if experience is not itself good for you, how the doctor will look at it? Second doctor problem is that he wants to reach the masses in rural area. There are companies like Tatwan E-Clinic now. If you connect with them, maybe it will help doctor to reach to the masses. So you are solving a doctor's problem. You are making him get more and more leads. That way you can solve his experience. If you're in derma part of it, if doctor is cosmetologist, if you run Facebook ads and the leads which you get from Facebook, if you divert to him, he will be happy. But our problem is that other than thinking how my brand is visible to physician, we don't think anything else. And that's why we think, digital doesn't work actually. Right way is maybe we don't know how to use it effectively. So when you are thinking of a doctor, think what he wants to know. Now about chemist, correct? Chemist has minimal problems. Okay, so if you look at the chemist part of it, he wants to know the availability, right? He wants to ensure that my ease of order management should be equal. I should be aware of new launches. I should be aware of new schemes, and most importantly, uh, I should be getting schemes. That is because a lot of stockists do not pass on the schemes to the chemist. That is known. So, of course, platform like you, they allow communication on a wider scale. That is one fantastic way. In Wokhad, I did a project with a company called as Medwall. They are order management ease. Means, for example, if almost more than 3-4 lakh chemists are already there on their platform, and if I see that maybe my brand X is giving 15% discount immediately right now, chemist can place order immediately on the app. MR will get MR can approve that scheme immediately because company has given it. Zonal manager will give a final approval. It will go to stockist and stockist will do fulfillment. And automatically, once the stockist certain amount is released from his CRM system, the mother depot or the CNF agent will fulfill that. It's a digital engagement. It helped to solve the problem statement of a chemist also and stockist also. Correct? So in a way, whether I'm using PharmaRack in one of the other companies, I thought of sharing this. They had a program for chemist incentivization and retailer fulfillment. Correct? Idea was good, but it didn't kick off after a couple of months. Why? Because chemist felt it is too tedious for him to take a photograph, to upload on an app, then follow up, and then get a fulfillment. They felt fine, Mama, all this I don't want to know. Now this program failed after a month, not because there was a problem with the channel, because you didn't study your stakeholder properly. There is in digital, there is something called as CES, customer effort score. Customer effort score is as good as your app. For example, if I want to know what is my account balance today, correct? And if I have an app, how many times I need to press the button on my app to know my score, to know my bank balance of HDFC? That is one. There is WhatsApp banking, which tells me only by putting hi, I will get to know my balance. So my customer effort score is very easy on WhatsApp. That's why WhatsApp banking works better. Similarly, for my retailer, which channel has less customer effort score, go with it, and you will not be regretting your decision of going digital. So these are two ways I thought of explaining the problem statement between a physician and a chemist. Yeah.
Great. So, Abhishek, I like the points that you definitely shared with us in terms of making it easy for your end customers. Your end customers can be doctors as well as chemists. And the
Yeah.
big point that you told is, as pharma marketeers, as marketeers, how can you help your stakeholders increase their business, right? So,
Correct.
for doctors,
Yes.
we were talking about leads and how we can actually ensure that his visibility increases so that he get more patients. So that is
Correct.
the whole interest of the doctors, which is definitely overlooked by many pharma marketeers. And as you told, pharma marketeers are more interested of selling their brand to the customers rather than worrying about how exactly the end customer can increase his business.
Correct.
So that is a well point, which definitely opens up different thought process for all of us. With that, Sanjay sir, I would like to now talk to you about the key area of marketing, which is targeting. So we have covered segmentation in detail with an insight from both of you, and we are talking about now insights. So targeting is definitely possible when we are having data and we know how to use this data in an intelligent way. And we are able to prioritize the segments in that particular data, be it our doctors or be it the chemists or be it the patients, and have strategies to actually approach them. So with that, the first question which is coming from the participants and from the people that we keep talking about, after you have all these things in place, can you share a success story where trade intelligence, having data of trade, has helped you improve sales? So as you told that data
Yeah.
is available today from various sources, can you share a success story where it will be of use to all of us in terms of how we can
Yeah.
use this to our advantage?
Yeah. So, Ashish, what I'll do is I'll not drop the name of the company and the brands. I'll tell what has happened and what has helped the companies or marketeers, and two, three quick anecdotes I'll tell, or the examples I'll give. Now, companies, as you rightly said, for targeting, you need data and data actually helping. But the limitation was many companies, the deployment is in metro class 1, class 2. So they don't have tier below town deployment where the economy is happening in that geography. The paying capacity increasing, new patient pool is coming, and then most pharma companies was just thinking what to do. And there comes the emergence of Medgini and many other two, three same kind of companies, third parties, which actually are, I call them reach optimizers. So whether it is Medgini or there's GoAptive or many other companies, they are reach optimizers. They actually make you reach to geographies which otherwise you are finding it difficult to reach, and they can give you the data of those geographies which otherwise you are not able to access. And this has happened already in last 5 6 years. I have multiple examples. Multiple companies have done that. They have gone into the tie-up or the collaboration or the contract with these companies, third parties. They are getting the sellout data, the either through the POS vendors, point of sales vendors, through their data access, or through the Pharma rack or these agencies I mentioned. Companies are able to get the pin code wise data very clearly coming, that what is selling where. And once you have access to that, it helps you immensely, not only in terms of customizing your messaging, where which patch is selling, which patch is not selling, whether you're talking about metro or otherwise. It also helps you to kind of evaluate your face-to-face deployment, right? Say, for example, if you're talking about Bombay, where I'm based at, and your patch data says that your business is coming very high in Kurla, where you have say only one rep and very low in the other. I'm just hypothetically saying where you have very low in the other, where you have two reps, then you can rethink about where to have rep and where you have to increase coverage and where you have to kind of down titrate it. That's one example happening across most companies, especially they have done with the legacy brand, tail end brands, which were otherwise not growing or degrowing. These brands are doing well for most of the companies because companies have gone with the contract with these reach optimizers to get two things. One, the sellout data, what is selling where. Two, even the demand creation. Now, some of these agencies also kind of developing capabilities. They started with technological solutions. Now they are building the strength on the ground, feet on ground, as we say. So they actually they brought the concept of syndicate reps. So suppose you're talking about a very interior market, tier 4, tier 5 market, where you can't have a rep, but you see that that geography has business because there is population, there is patient pool. Now these people have a syndicate rep. The same very rep can promote 7 8 companies product, right? Depending upon the contract. So you are interested in promoting only one brand, where you want to go to the rural geography and want to create demand and fulfill that. You can use that concept of syndicate rep. your one or two brand will be added in the basket of the products which this rep is promoting. So reach optimizer is one classical story. It's not a future. It's already happening for 4 5 years. Many companies are doing it. If your company is not doing it, evaluate, whether it makes sense. Second thing is what I've done in my previous organization when we were, so as Abhishek was talking and Ashish also spoke about pharma discounting or the trade solutions or taxonomies, whichever way you call it, different kind of trade interventions or commercial interventions, they were very conventional compared to the consumer and FMCG, where they have gone to the, unit level at the consumption point, and they used to titrate discounting in consumer at the consumption point, at the retail level, which was not the case in pharma. It was primarily focusing on the primary discounting, which is happening at a stockist level. Now, most companies were at the mercy of stockists to decide whether the discount will be passed on to the retailer or not. And in case it is passed on, whether it is the same percentage what you have given is going to the retailer or not. And there is actual replacement or the substitution happening at the retail level. But the decision was in the hand of stockists, which is changing. And what we did in my previous organization, we have kind of developed our own app, in-house app, through which we were giving discount directly to retailers through a pay wallet. And that program was really working very well because we have taken the data of last 36-month purchase of that pharmacy, individual pharmacy. And then we were able to design the discounting basis the purchase history of individual pharmacy, how much discount this retailer should be offered, whether it is 2% or 20%, depending upon the quantity this guy is buying. Now we were able to do that, which no other pharma company that time was doing, which is giving secondary discount, customizing it to the retail level, which was possible. Again, possible only when you have trade intelligence, which is 36-month past history of purchase of that product. Then you can have a predictive model of suggesting next 12 months what this guy is going to buy, which was not possible otherwise. Another thing is geography sales tells you where to have this digital campaign. So again, if you look at the digital strategy or digital campaign, it used to be very generic versus what Abhishek just was trying to tell you, that it is very customized now. Different channels requires different content of different duration. And then it has to be customized to not only the channel specificity, even to the customer or the audience or the specialty. Specialty behave differently, geography behave differently, and your content has to kind of align with the customer profile as well as the platform requirement. The duration of the content or the time for which a customer is willing to listen or to see is shrinking like anything. So that is what I've seen in last few years. So your content has to be very short duration, high impact. That is what which is working. So again, coming back to your question, trade intelligence, of course, yes, it is happening and it is helping. Trade intelligence tells you where your brand is selling how much. Depending on that, you can titrate your discounting. You can also customize your communication. So I think these are the two areas which you can do basis the trade intelligence. Over to you, Ashish.
Well taken. Yeah, point well taken, Sanjay sir. I think the point which actually I liked, which is about syndicate rep. Many companies definitely have limitation when it comes to budget and aspiration when it comes to reaching out to larger markets, especially rural markets where you cannot justify the cost of resource. So syndicate
Absolutely.
rep is definitely a smart strategy for companies to penetrate in the markets in a faster, smarter, and better way. So thank you for sharing us that. And also the geography-wise sales. We are talking about pin code-wise sales where you have data, you know where to focus, how much to focus, and where not to focus. So that is also something which pharma marketeers can seriously look upon. And with that, we have another nice question which is coming up for Abhishek. Abhishek, we wanted to understand, as pharma marketeers, we have decided what campaign we want to actually run. So while we are clear about that, as pharma marketeers, what are the key measures which will help us to see if this campaign is working or not? So can you probably share that with some example in terms of what are the KPIs which a person should have while they measure the success or failure of that campaign?
Yeah, sure. So when I think of KPIs, I think later on, like I might even show one small sheet directly and calculate the KPI on the spot. Fire. So generally, let's take any digital one campaign, okay, and try to connect it with the physical world of it. Let's start one campaign stating as I have run a banner ad on a community platform. The reason I think a lot of people what they did in COVID, one big problem is that when they felt website is a thing, app is a thing, everyone launched their own apps. Everyone started doing everything on our own. I will build my own video platform. I will build my own app. But when you have to order a food, you don't search Sainath Veg Restaurant. You open on Zomato because Zomato is a community, correct? So, for example, let's say that I have run one banner ad campaign because I wanted to target people who are coming on the portal of cardiologist. So I ran a banner ad campaign on that, maybe PubMed or something. I ran an email marketing campaign also, and later on I have also done a community based product launch. Okay, now let's evaluate all three. Then you have to create a funnel. Firstly, if you have to create a funnel, you have to firstly think that for how long or for how many people, how many impressions are done. What is the impression? Impression is frequency multiplied by reach. That is a formula of impression, correct? Means how many times in feeds my product was shown. Second level below that is reach or unique reach. Means how many doctors actually have seen my content and which are the ones. You don't get data for impression, but you get data for maybe engagement. After reach, you further come below. If you have an email or a call to action button there, you might see number of people who have clicked on that. That is further below the funnel. Next, once you have a click data or a reach data, you over a period of 3 months, if you do this, you will clearly get to know which are your doctors who are frequently opening, frequently clicking. Correct? That can happen even with WhatsApp. So when I run WhatsApp campaign using one of the products earlier, we tried WhatsApp campaign via Troika Tech, which was a bulk. Then we tried WhatsApp campaign via Root Mobile, which I used. I exactly need to get those numbers of the physicians who have opened and checked it. Now, ideal next thing is I can get open rate, click rate, basic standard formula. You can get fine. This is what it is. There is a meaning of every KPI. It is not just a KPI. There's a meaning of it. If my open rate or if my delivery rate is pathetic on WhatsApp, it means my data is pathetic. Number one, very important. Or second, I don't have numbers only, or I'm doing it too much. If my delivery rate drops if I run three WhatsApp campaign on 3 days and delivery rate drops, it means WhatsApp by default is blocking me for spamming them. That is one part of it. Second, if my open rate doesn't improve over a period of a 1 week, correct, it means I am don't having an idea that whether the person whose WhatsApp number I have is he using WhatsApp also or no, or whether that doctor comes under the category of tech savvy people or no. That is second part of it. Three, if my CTA or the click rate on WhatsApp or anything is less, it means maybe my content was not active enough, which will compel somebody to click on knowing more. That is third KPI and the meaning of it. Correct? So first check your data. It will help you improve your delivery rate. Check your subject line, content, and main part. It will help you improve your open rate. Check your content depth and catchiness on your CTA, which will help you open the click rate. Now I have the data of doctors who are frequently checking the content. Now I have to check that these 100 doctors are they part of my A, B, or C list? If all 100 doctors are part of my C list, it means there is some discrepancy. What is discrepancy? C list doctors have a less frequency of MR visit compared to A list doctors. And they are told don't give so much importance to C. But when I see ultimately my openers are C, means they are showing the interest. So it's my duty on the field to convert from C to B and then B to A. That is one part of it. Correct? If I do that, then I will help us add more active doctors into my core list, which ultimately my MRs will improve. That is one part of it. And why KPI should be there only for the campaigns? KPI should improve even for the MR. When I was in Wokhar, Ultimately, I was hardly 20 days old, and we went for a budget meeting in Hyderabad. Okay, at Leonia, you must be knowing their resort, Hyderabad at Leonia. So that time I was told to make what kind of KPIs you want to recommend, how strategy you want to recommend. I said, see the
Yeah.
traditional KPI of medical reps, which are number of calls per day, number of doctor visits per day, your credit notes, your prescription generation. Along with it, there is additional KPI of data accuracy. How many of my medical reps consistently have given me that data? They have filled the data into CRM, which has never bounced. How many medical reps have filled the email into the CRM, which has never done a hard bounce? That shows my MR of today's generation is equally data savvy too. I can't expect MR thought process of early 90s and expect my campaigns to be successful earlier. Right. So let me share one small Excel, just which will clear my with the KPI part very clearly. Okay, I will just show a small
Actually,
working on.
very practical things that you are talking about,
Ah,
which make us think that with changing times you need to change.
yeah. So just give me
So
2 minutes. I
you
will just
can't have the
explain on
old
the.
thought process.
Yeah. Sure. I will show it on the Excel sheet. Just an ROI perspective, because ROI is a question which is very rapidly asked, and I also understand the
Yes,
purpose of asking that question is to make digital show some kind of pessimism towards it. Nobody asks what is
certainly.
the ROI of my HealthBL or ROI of my participation in AP. Nobody asks because it has never been
Yes.
asked in the history. But
Yeah.
whenever I have to avoid taking decision, I ask ROI. So let me show you one small exercise online.
Certainly.
Okay. Sure. So here my Excel sheet is shown. So this is one activity which we did when I was in Docplexus with one of the biological companies based in Bangalore. They wanted to do a product launch for a hepatic serum. Correct. So let me check. So when we had launch day, correct, totally we had close to around 2,500 registrations. Okay, these were registrations. Over a period of 15 days, that product launch was seen by close to around 2,000 doctors. Correct? 2,000 doctors were close to around people who actually saw that. People who clicked on give me sample. This was the CTA which was consistently put. They were close to around 175. These are actual numbers, not hanging around. People who actually called, and out of which, when you see this kind of a funnel now, correct, so you can see this is turning into a small funnel on the right hand side, correct. So I know things are moving it like this. Let me also tell you approximately cost of incurring into this campaign. The cost of incurring this campaign was 3,75,000. The entire product launch is something, take it as 4 lakh maximum. Okay, this is done. Now what I do, marketing people actually filtered this 175 people, and they, when we give them data, they say actual A-list doctors who will give prescription are close to around say 100, and 100 are those doctors who are telling me I have at least 3 patients in a month for this hepatic thing. Correct. So this 100 is a baseline I will consider for now. Now let me check. Ideally the cost, or rather PTS, for that hepatic serum was close to around say 6,000. I will still take it less. I will take 5,000 rupees.
Yeah. So PTS is price to
Price
stockist.
to stockist is 5,000 rupees. Correct.
Perfect.
In that way. So if I consider over a period of say 6 months, correct, number of
Yeah.
months is equal to 6. Correct. So out of
Perfect.
say these 100 people who are keen on doing this, they will write for one prescription into 3 patients they have on a monthly basis. I will multiply it by 6. Correct.
Right.
People who have shown the interest, average
So
cost
this
of
is the total business that
this is
we
the
can
total business I'm
estimate.
expecting. ROI will always be prospective to start in digital. It will never be retrospective. Rarely it will be. But to start, to make
Absolutely.
a decision, at least it will be like this.
Hmm.
Correct? So this is the amount I received. Right? Now, actually, if I have to calculate the ROI, let me use the formula. This minus my investment divided by my investment. Correct? If I enter, this is 21 times, not 21%. I have to multiply this by 100 actually, if I have to actually calculate percent.
Yeah.
Right? So much percent, or converting this into percent, is my ultimate ROI if I tell you. Correct? So if somebody asks me what is the ROI, to explain in a funnel manner, I can do this. I can do this. Correct? Take a worst case
True.
scenario, even if this drops by say 50-60%, I'm still making a decent deal. Now let me tell you, this is not just revenue centric ROI. Correct? This is revenue centric ROI. I fully agree. Now let me calculate reach centric ROI. Reach centric. So for example, I invested so much in my campaign, and ultimately it reached 2,500 doctors at least. So what was my cost per reach? My cost per reach per doctor was 160 rupees. There is another tool which is CPL, cost per lead. You can even do that simply. Just divide this with actual accurate people. 4,000
Yeah.
rupees. Correct? So this is my cost per lead. Now my cost per lead of 4,000 is actually gonna give me business of 100. So you say one doctor is going to give me 3 prescriptions in a month for this amount of PTS. So still my revenue per doctor, which is another KPI metric you can consider, this, which is 15,000, is still more than this, which is my cost per lead. Correct? I will just stop sharing. The only purpose of this activity, whatever I shown on Excel, was just not to give answer in a generic manner. I had to show certain calculations, and ultimately KPI is what? KPI is ratio, and people twist and turn the ratio the way you prefer. Correct? If I invest in share market, I not necessarily I'm going to see the PE ratio of all the funds. I might as well see my WhatsApp group and make a decision. But still, if somebody asks for a data-driven decision, whatever I have shown, brand manager can at least think on that line and say, look, this is what thought process we have for going digital by showing these KPIs. Okay, that's all I can say for now.
Absolutely. So the way you have approached this practically in terms of measuring revenue-based ROI, reach-based ROI, and cost per lead. So this over a period of time, whatever campaign that we pharma marketeers are doing are sensitive towards this. And rather than focusing on the cost of the campaign, we have to focus on the effectiveness of the campaign in terms of what exactly is the impact or what exactly is the output that you will be getting so that the campaign, whatever you are investing, makes sense. So rather than worrying about the cost of the campaign, I think we should be worried about the output of the campaign. That is well explained in your slides that you have told. So in continuation to this, the questions which people are asking, it is about the tools and technologies which will help pharma marketeers to implement when it comes to trade intelligence or improved. So this is a question which we are talking about. What new tools and technologies will change pharma marketing in 2026? So Abhishek, you come with a background of IT and you have in love with data and analytics. So, and you are also into teaching. And with that, I would like to ask you, what are the new tools, technologies, skill set that we as pharma marketeers to learn so that we are relevant in the days to come?
Yeah, sure. So firstly, we can compare the old tools and the new tools. Simple. Correct? Now, I think to make your presentation simple, earlier everyone was using tools on daily basis. Correct? These are for content. These are the tools available. Now look at the presentations. Correct? So in presentations, I guess people are bored of seeing the screenshots of Microsoft Excel on a presentation. Power BI, it is costly. Another reason for not using Power BI on a common man thing is that everyone doesn't have Microsoft account. You will have a lot of problems with it. There is simple Google tool, Google Looker Studio, which was erstwhile called as Google Data Studio. So I have my own video on explaining Google Data Studio. I can maybe later on put it into the chat if needed. I had conducted a workshop for our working professionals. So Google Data Studio is simple drag and drop technology for business intelligence. It is just as simple as Power BI without coding, without you knowledge of SQL, without everything. Just drag and drop your KPI will be ready in that. It will be fully ready in that. Correct. If time permits, I can show a snap of it. But yeah, you should be good enough to visualize the data and present the data. Discussions actually start after data is visualized, correct? Because visualizations matter a lot. Not just Excel sheet is okay. Everyone is practicing on that. But if you know Google Data Studio, you will not need Power BI. So another calculate ROI on that itself. That one skill of Google Data Studio is going to cut down on a per person's license cost of Power BI. And everyone can't use that. Everyone can't have access to that. Simple, use that. If you have to run a WhatsApp campaign, there are 3 ways to it. First, either tell your field rep, circulate a message, they will do it. And second, if you want to do a bulk without expectation of any data, with 15% paisa per message, you can try Troika Tech bulk message, 5 lakh bulk message with 15 paisa each. If you don't want that, there are tools like which are API interface WhatsApp integration campaigns like Gupshup or Root Mobile. Root Mobile has an excellent feature which I personally used in my last company as an agent dashboard. You act like a call center agent there. Correct. So in case whenever Wokhard was launching nafithromycin, when doctor showed interest, when it is launching, when can I get a sample? Is it applicable for this? Luckily I had pharmacology master, so I was able to immediately respond on that. That improves the customer experience. It is not that he's chatting with a bot, he's chatting with a human. That is one tool for interacting with doctors directly on the call basis. That tool you can use. For shrinking the data, Copilot everyone uses. Correct. If you want to create, if you have a 1 hour doctor video, upload it, use that. It will be easily utilized for giving a summary of it. N8N can be used for combining the part of it. Correct. There is a simple tool like Napkin AI to convert that boring text into visualizations.
Yeah.
So you should know 3 tools or 4 tools at the most. And you should know what is making your life easy. Just because somebody listens to me that I use Copilot, you don't start using Copilot. If a data analyst, he should use more of Looker Studio. Simple as that. You should know what is your work and what repetitive tasks you can cut down on. Simple as that.
Perfect. I think the tools that you have told us, which we need to learn immediately, and the bonus from your side, which is Google Data Studio. If you can share that link to us, it will benefit to all the people who are joined us, and they can learn this quickly. And you have told it is as easy as using your email or using your WhatsApp. Please share with us so that all the people get
Yeah,
benefited from
sure.
it.
So if
And
you have
Copilot
2
and
minutes,
Napkin AI.
so if you have 2
Yeah,
minutes,
sure,
I will show
certainly.
the tool directly. Okay, rather than
Perfect.
doing
Please,
further ado.
please.
So this is a
Yeah.
session for, I had taken one session for management students in IES and NMIMS. So
Yes,
this is the workshop which I had taken there. Correct.
certainly. Thank you so
Now
much.
look at this. I hope my screen is visible.
Yeah, very much.
Correct. Yeah, sure. So can you see this is the basic thing which I have used here. I have not completed it fully. Can you see this? This is the basic Tata 1mg data. Okay, which I have
Right.
created basic on that. Now, generally, if I have to know what is happening in Bangalore, correct, rather than what we do, we fill in the Bangalore, we filter and all that. If I click only on Bangalore, can you see the whole data changing up?
Yeah.
When I go back and I want to know what is happening in, say, Pune, if I click on Pune, the entire tool is changing it up. Clear? I exactly know how
Yes.
many orders came, how many brands came, what was the GMP of those brands, only at a click of a data. And I have
So
prepared
this
this
is
in, like, say,
using
this is Looker
Google Data
Studio.
Studio.
Google
Right.
Google Data Studio. Now the name is Looker Studio.
Yeah.
Correct. So yeah. So for example, yeah, this is another sample data I have created. It's not actual data. It's just a sample data.
Yeah. Yeah.
Correct. Now see, now I know what KPIs matter to me. I want to know how many orders came on online platform, what was the GMV of that, how many brands were sold, and how many units were sold. So if I really have to understand my brand ability over an e-commerce platform, I might as well check simply what. Let me see what is happening in Lucknow, city like Lucknow. So I know in my city like Lucknow, which are those brands being sold, Glargine or methylcobalamin or Levon or
Wow.
Glima, etc. And they also show how many units were order platform. Correct.
Super.
So now if you look at this, the reason this tells me, it tells me the centricity of my data and things like this. Now look at this part. If you go in detail, this Indian map, it clearly shows my orders online platform are very much concentrated on the northeast side here on this belt. So it is very important
Yeah.
for me to maintain a good fulfillment rate on the northeast side of it. Now you see, fine, maybe यहाँ पे तो 10 ही दिख रहे हैं, बाकी का क्या? So let me take an example of very small city, almost at the end of it. Let's take example of Hosur or Alwar, correct?
Yeah.
Even in city like Alwar, people are placing orders. there are some sale is still happening in Haryana area, and maybe their glimepiride is getting more sold, methacobal is getting more sold, correct? And so it is not about just a tool as such, it is just about ease of making it. So I barely took 20 minutes to make that data, but
Wow.
same thing in
Right.
Excel might took an hour, because I have to create so many pivot tables, connect, then report connections. So tool is something after which helps you to analyze data better, as simple as that. So be good in Excel, no doubt, that is something which must be done, but go beyond that, because I'm sure if somebody, Sanjay sir, when discussing with their teams, this thing must have happened, that to analyze data they take Excel screenshot and upload. Why? This tool can act as a PPT and Excel sheet both. Learn it,
Exactly.
utilize it, as simple as that.
Perfect. So this definitely was insightful and eye-opener to all of us. Thank you for sharing this, Abhishek. And so we come to the end of the session, and we have an important thing, which is a feedback from our people to help us improve better. And we also definitely have the speakers, the winners who we would like to announce, who will be winning the book from our side, which will be delivering to your doorstep. And please give us a feedback on how relevant this webinar has been to your business. Please scan the QR code, or my team will be happy to share the link to you in terms of relevance of content as well as implementation of the same. So for the very first time, let me be honest, the chat has been buzzing with regard to the questions and the interactions from all the delegates. And I really thank you all for being active in this session, which really helps
Ashish,
us to
I have a
understand.
point to make, if time
Yeah.
permits, a quick point, which
Yeah,
is,
yeah,
I
please,
think,
sir.
important for the audience.
Please,
Because
sir.
of the phenomenal presentation by Abhishek, and the ease by which he is navigating through data and showing the tools, I'm more than confident that every single person on the call will feel excited to kind of use more and more data and more tools. That's a given. But a word of advice to everybody, that while we all are talking about future, we still live in present. And when you talk about present, you still have large geographies where still technology penetration is still work in progress. There are
Yep.
large set of customers and source of business where they still don't have that kind of comfort with the data and use of tools, and therefore keep a balance of your approach in terms of strategizing, whether in terms of which access channel you are using, how much you are spending, how your overall integrated strategy looks, keeping everything in mind, which is right allocation to face as well as to digital, and then kind of optimize, keeping that in mind. So I think my word advice to everybody here as marketeer is, keep that balance, right? Feel excited for sure, feel passionate about where the future lies, but then keep an eye on where you stand today and where your current source of business is. Just to give you one example, I also felt excited about one of the campaign where I went ahead with some of the data I wanted to share with the retailers, and I used the email marketing. I'm talking about 4 or 5 years back. We have progressed from there, and then later on realized that not many retailers are still, especially tier 3 and below geographies, are using emails that frequently for business purpose, right? So the only word of advice is keep a balance, look for the future, stay updated, as Abhishek was suggesting. Have ease about right relevant tools. Tools are so many. Find out which one is most relevant, as he was very rightly suggesting, and then kind of optimize everything and keep a balance so that you take care of present, you deliver the revenue, and you look forward for the future. I think over to you. This is important, I thought I'll say.
Yeah, that's very much relevant. Actually, we are sitting here where a lot of people are having limitation when it comes to sharing data. But one more point which was coming in the discussion while we were having with you is the data readiness, where you expect the MR to slowly, steadily. Obviously, you can't put everything on day one, where you ensure that these guys are becoming data savvy. So that is a step in progress. Things cannot
Yeah.
change overnight, and you have to be mindful about it. And the people who are having data and they are able to use it in a better way, you are able to take better decisions. So that point is definitely taken here. So with that, I would now like to announce the winners for today's session. The people who have participated in the self-assessment activity. irrespective of their score, they have participated and they have participated in the fastest way possible. We definitely don't want to share their score, but the people who have participated and who will be winning today is one, Mr. Ajit from GSK. I would like to congratulate you for being the first winner for today's session. And the second winner for today's session is Mr. Manish Kumar from GoActive. So, congratulations to both of you. Team, can you please spotlight them?
Congratulations.
Thank you. Thank you very much, Ashish.
Thank you. Thank you for joining. And so a little about what we do at Medgini. A lot of people have been asking us. So Medgini as an organization, we started in 2012 and we have been serving the pharma industry in terms of awareness, availability, visibility, and loyalty solutions. We have serviced for more than 60 plus pharma companies, and we have made their life easier by becoming their reach partners. And we definitely look forward to work with you. We are based in Hyderabad, Bangalore, and Mumbai. Anytime you feel that we can help you fast track your journey in terms of reach, please call us and we'll be happy to have a talk with you. We have been serving, yeah, so these are our contacts. You can reach us out. And on behalf of all the delegates who have participated, I would like to thank our speakers, Sanjay sir and Abhishek, for the knowledge that you have shared with us, for the time that you have shared with us. And on behalf of Team Medgini, who has worked relentlessly for getting huge number of people to participate in today's session, I thank my team Medgini for their effort here. And on behalf of the team, we would like to give you a gift of the book, which will be of relevance to your business, which is Sentiment Analysis for Pharma Marketeers. Please accept this as a token of gratitude from our side. Abhishek sir, Abhishek ji and Sanjay sir, thank you so much.
Thank you very
Thank you
much.
so much.
Really appreciate it. Thanks for the
Yeah, so there are
opportunity.
a lot of questions which have come in the chat. If your time permits, we would like to take a couple of them. And with your permission, we can share your email ID or
Yeah, sure.
LinkedIn
Sure,
profile
sure.
so that
Yeah,
people,
sure.
a lot of people have asked that they would like to connect with you and take this forward. So I would like to take a couple of questions here, which yeah. So this one question which has come from Tushar, which says beyond IQVIA and Nielsen data, what are the options to understand numeric distribution and weighted distribution of our own brand? So would you like to take this up? Sanjay sir, would you like to take this up? The question which has come from Tushar. His question is beyond IQVIA and Nielsen data, what are the options to understand numeric distribution and weighted distribution of our own brand?
Yeah, so you largely we use IQVIA data only. I think,
Yeah.
Abhishek, are you using any other way of calculating that?
No, sir. See, for example, every even Pharmarec had their own database. Which that time it was not
Yes.
merged with AIOCD AVEX, of course, but
Mm.
Pharmarec had a pin code level data too. Correct.
Mm.
But now the reason IQVIA and trusted because they are old players in the town. Correct. And
Yeah.
that is the way the data which I showed on online, it was 1 mg data because we had partnered with all the e-com player. Similarly, every e-com player has their own database which you get at the end of the month. That can give you pin code wise or a small city level data just to understand where your brand stands. That's what I did there.
Yeah.
So those were our brands only X. You know the
Yeah.
penetration of it. You know the order geography of that. That is enough for you to give a qualitative insight per se.
And some companies are actually directly contracting POS vendors. So POS vendors, point of sales,
Yeah.
through which they do the invoicing, they get the data access from there. You can get the sellout data from there. As I said in the beginning, there are two ways of doing it. Company can directly have a contract. There are major POS vendors, who have presence across many geographies. So your targeted geography, you can pick the POS vendor, can have a contract to get to the access of the data, or you can contract Pharmarec directly. They have huge number of POS vendor contract. They will give you that data. There is no other company I know which gives you better than them in terms of giving, what you call point of sales data, sellout data. And then there is a lot of data by even Medgini also you can get. You can get it from GoActive. There are many companies who are working on the very micro level of data digital strategy. So they can give you data basis which geography you want to target. And there are enough vendors in the industry who can give you that.
Right.
And don't forget the
So
power
there
of
is,
AI, by the way. I mean, which is changing the landscape. If you give the right prompt, it may surprise you to give the data, which, I mean, we recently in our exercise, when we were planning our next year planning, starting everything from brand strategy to the deployment, all of us internally in my organization used AI to get a data which was unthinkable, to kind of see even pin code level across India, we have evaluated in terms of infrastructure, in terms of whatever new coming, whether healthcare or otherwise, all KPIs you can. So if you have right kind of prompt, uh, I mean, it
yeah.
is on your fingertips. You may not require many other agency data. Of course, some data you will require agency if it is very customized kind of primary or secondary research done through IQV or otherwise.
Yeah.
Yeah.
Perfect. So I think we have two more questions which we can take up. We have one question coming up from our previous speaker, Manas Das sir, who has participated being our key speaker for RCPA and POB. He has got a very relevant question. He was saying that many a times in the past session, I was asked on the ways to engage rural doctors other than consultants, whether digital alone will suffice is also an important point to understand. So, Sanjay sir, you have worked in rural
Yeah.
markets. You understand the
Yeah.
limitation of data technology
Yeah.
in rural markets. So, what is your take on this?
That is precisely when I said we need to have a balance.
Yeah,
Maybe our reflections are driven by our age. So since I am
yeah,
50 plus, I think that way. Abhishek looks like 16-year-old, so he looks like that. He thinks like
yeah,
that, very passionate, very aggressive. That's what I was, jokes apart, I was trying to tell you that while we talk about technology penetrating and technology making huge difference in the way we think, strategize, and drive things, still your current business, the source of business when you talk, you have areas and geographies where still it is work in progress. And even when the internet has reached, you don't have that kind of data integrity coming from those geographies, the capability to handle data, whether it is doctor or chemist. And therefore, some of these geographies, when you talk about rural, your physical presence matters, and that is why vendors like GoActive and many other, and I know Ashish, you are also evaluating on the same line.
yeah,
So all these vendors who are big in India, I mean, as a third party, are already evaluating feet on ground as a hybrid model along with their digital capabilities, whether through app or otherwise. So I think at least for next few years, you need to have your physical reach out strategy working in parallel with your expanding digital strategy. That's the way forward, and especially to rural. But simultaneously, I'll say, Ashish, it is changing massively. So
yeah,
what was there in rural, say 5 years or 10 years back, is not what rural is. The penetration of YouTube, the penetration of internet is mind-boggling, and the acceptance of technology, the
yeah.
healthcare infrastructure expansion uh, at a pace which is unthinkable if you don't know it. So I
Certainly.
think the perception-driven mapping of what was rural 5 years back will not hold true. Rural is changing very fast. The penetration of internet changing everything. So what works here will work there. It will take some time. And that sometime talks about that balance I was trying to point out, that have a balance as a marketeer of current source of business, need for face-to-face rep. And face-to-face rep still is required, right? So, I mean, feet on ground is still required to orchestrate your integrated strategy. So we all were talking about omni-channel strategy for last 10 years. Now it's more than
Mhm.
omni-channel. We are talking about do what is required where. So it's more about an equal to one segmentation now, which was there already on online platforms like the Amazons of the world. Now in pharma marketing, we are moving in that direction, and we all are very clear in most pharma companies now that one vanilla for all strategy is not working for anything. Whether it is brand planning, whether it is communication, whether it is deployment, whatever you talk about, motivation, because culture varies across, behavior varies across different geographies, and therefore you need to factor those nuances. And therefore, Ashish, in the beginning, as I said, that is very critical that you see India not from one perspective, you see from different
Mhm.
geographies perspective. Everything changes in terms of per capita income to per capita spend to whatever you talk about healthcare and
Yeah,
doctors per 1,000. All that data will change, and therefore the strategy will change.
yeah.
Therefore, the
Manasa
strategy
sir,
will
you are there
change. So
with us
your
today.
macro level.
Very well said,
Yeah,
Sanjay.
yeah.
Very well said. Sanjay, only one query that I have. while you have
Yeah,
touched the relevant points, uh, see what is happening now when we are talking about 65 billion USD to 130 billion USD and subsequently 250 billion USD. That is the projections as per IBF they have given, and for the Indian pharmaceutical markets, including exports. My point is that even today, very good segments, around 3.5 lakhs of population, who is Abhishek, and you both will know, those who are MBBS doctors and
absolutely.
Yeah.
they are non-MBBS doctors too.
Yeah,
There are even today, there are
yeah,
non-MBBS doctors too. If you have followed LinkedIn, somebody writes MSc, Dr. Manas Das MSc, physician. It has come out. And there are many such cases. How do we as sales marketeers, or like I'm referring to everybody in the industry, how do they go ahead with that in their digital things? Because I have personally made a lot of interventions in digital, both in RX, OTC, OTX. So how do you really take them? Probably in your next session, that could be a very
Yeah.
critical thing to be discussed with many of the younger guys and also seniors like me and you. We what we know is the tip on the iceberg.
absolutely,
Mhm.
We don't know
absolutely.
anything else. So that could be, that is what was I was just thinking, because I had two medium-sized companies manager sessions in last 2 months continuously. So that is where these questions is coming up very frequently. So I thought that that could be something relevant, but I
Yeah.
must say, uh, Abhishek has really given lot of good things. You have given lot of good things. For I have learned many things. So
Appreciate,
I think
appreciate.
I'm sure that youngsters will also learn many things.
Truly appreciate your kind words, and I reiterate what you
Not
said. I
kind
think,
words.
yeah,
I'm a ruthless fellow. Only call a spade a spade. I enjoyed this.
thank you
Thank
very
you
much.
very much, Abhishek.
Truly
Thank
appreciate.
you, Ashish, for inviting. Thank you, Sanjay.
Thank you very much. Appreciate. And as I said, Ashish, I mean, the same point, the India is very diverse. We get swayed by this very passionate, what you call, the picture presentation happens about AI or any new technology coming in, and there is utility for sure. There is future for sure. But your current source of business, large chunk of that still lies in geographies where still it is work in progress, and therefore have the balance as a marketeer. Have the balance, kind of have the
Mhm.
integrated strategy where you take care of what is happening right now through right now conventional channels, and then kind of have a synergistic integrated strategy of having digital, which is supplementary to what you're doing, and then integrated way you drive it in a future which is very promising to each one of us. Yeah,
And probably,
Perfect.
Ashish, for you, that opens up lot of opportunities. Ashish, I can
Yes.
tell you there are a lot many things to be done because the
Yes.
market, a chunk of the market size is remaining in the, as somebody said, either Abhishek or Sanjay, I forgot, that even today they are not invaded. The rural markets, they are even today by
Yes.
the giants, many of the leading companies, that's not invented, which they are now forming teams, rural teams and all, they are now starting to go to these markets.
True.
and also to add, I know we are already ahead of the time, so kind of, I mean, very late, but still I'll make that point. Abhishek made a very important point. So there are a lot of internal processes which, because of the technology integration and technology now making it possible, you can see the improvement. See documentation of a lot of stuff which reps do, whether it is RCPA or the profiling of the customer, as Abhishek was very rightly mentioning. We need to have that tracking also, that which are the areas, who are the colleagues who are actually tech savvy and able to use the technology formats and giving you right information. So I think you, and that is why the internal processes many a time, see, as marketeer we depend, why we depend on IQVIA or say SMSRC or Pharma Rec and all, because internal data we always see with suspicion that how correct this is, how much error there in the internal documented data. Now Abhishek made a very relevant point that we need to work
That's
using technology, the internal data, also has to be kind of better than what it
so
was in the past.
Sanjay, I am what you said is very close to my heart. I have served in organization for more than 2.5 decades, closely 2.5 decades. And prior to that, building brands. I'll tell you, without our CPA, nothing can happen. You can have the best of the strategies. If customers' profile is not being made, nothing is going to happen. So that's something which is very close to my heart. Sorry, Ashish, I took some time because it's a very interestingly discussed by both Abhishek and Sanjay.
Thank you.
Yeah, no, I totally appreciate the inputs, Manasda sir, which you have shared with us with your experience and with the time that you have given to us today. And in the chat, as many of you have asked for the profile of Sanjay sir as well as Abhishek, I am putting it. You can feel free to connect with them. And with that, we come to an end of the session. But as promised, all the people who are there with us will be getting an ebook on the conversation that we have today. Very insightful, very in-depth discussion that we had today. And this will be given to you a week from now. And the winners will be contacted by our team for your postal address, and the book will be shared across to you. On behalf of the speakers, we thank you for spending your time with us, and the speakers, Sanjay sir as well as Abhishek, appreciate your knowledge as well as time that you have shared with us today.
Thank you, everybody. Thanks, Abhishek, for
Abhishek,
a
any last
fantastic
word from
event.
your side?
No, I think when I remember just an incident when I was in Docplexes, even though I was handling the cluster lead for project management. Okay, so I happened to go at one of the pharma companies, and the I can say a president or a vice president was quite digital pessimistic. Okay, so he asked me that, and that company was almost, if you look at the IQVIA rank, they were almost between 40 or 50th rank. So they asked me that who we are working with. So I shared names of Sun, Abbott, Black Elderma, etc. He said, "अरे ये तो सब शाहरुख खान और आमिर खान लोग हैं. डिजिटल में हम जाके क्या करेंगे? आप तो सिर्फ आमिर खान के साथ काम करते हो." So I told him, "Sir, आप शाहरुख खान आमिर खान हो भी नहीं. You are in the league of, Manoj Vajpayee, Shreya Pilgaonkar, Pankaj Tripathi. The reason these faces are known to people because of digital. There is a saying in digital. If you have to, it is easier for a David to compete against a Goliath on a 6-inch screen than 19,000 pin codes across India. So if you are small,
absolutely.
You should be first in digital. And the purpose of digital was never to defeat a giant. It is maintaining your uniqueness despite the presence of giant. As simple as that it was, yeah.
No, so well said, yeah. Absolutely, absolutely correct.
This is a channel which definitely we all as marketeers would like to leverage the right way, and definitely the right tools, presentations that we have seen today will enable us to do our job better. I sincerely hope all our people who have joined us today implement something in their business tomorrow and level up their particular game. With that, we come to the end of the session, and I thank on behalf of my team for being with us today. Thank you so much.
Thank you.
Thank you, everybody. Thanks for joining.
Bye-bye.
Look forward to see you next month with an interesting topic with interesting speakers.
Thank you.
Thank you, sir.